So hi there everybody, my name's Matthew Shaw. I'm the Chief Executive of Great Ormond Street. Everyone calls me Matt. And I'm joined here today by Grace, who's one of our patients here at GOSH from the YPF.
Hi everyone.
So I think myself and Grace are going to try and answer a few questions that young people have put forward to us in terms of just explaining a bit about coronavirus, a bit about what's happening in the hospital at the moment, and I'll absolutely try my best to answer them in the best way possible, using simple words and language that everyone understands, which we are terrible at in hospitals when we speak to people. So I'm absolutely going to try my best to do that. So Grace, do you want to fire away?
Yeah, definitely. So the first few questions are from Eric, who's 10. How does GOSH respond if a child gets coronavirus?
So I think the first thing to really remember is that coronavirus for children in general is actually not a significantly dangerous disease. And I think that's really important to remember. There's only really small numbers of children that become ill with coronavirus, so there's no need to be worried or anxious, because actually for almost all children that get coronavirus, it's a really mild illness. And some children, luckily, don't even know they've had it in the first place, which is really lucky for them. I think there are some things which we need to do, some important things for children who get the disease. And they are that some children are a bit more susceptible, a bit more prone to getting a more severe version of coronavirus. And there may be some children that their immune systems don't work quite as well, or maybe some treatments that we give where their system doesn't work quite as well. And for those children, clearly we're going to really try and look after all of them, make sure we're touching base with them regularly. I think if you're coming into GOSH, what we need to do is to keep you absolutely safe, and we've done some really some things around that. For example, we've got little starfishes all around the hospital by which we're trying to keep people and keep their distance. The hospital's a lot quieter than normal, so if you need to come in, it's actually, in terms of keeping distance, it's a lot safer. And actually GOSH is an environment where we don't have lots of patients with coronavirus, so that's another reason to not be fearful or worried about coming into hospital. We're also not, we also don't recommend that anyone who has symptoms from family's perspective come into hospital, because that just puts children at risk and puts our staff at risk. If you're a patient in the hospital, what you'll find is that we'll move you to a specific area of the hospital where you can get the best care possible. And that'll keep you in your own area with your family, and will give the appropriate absolute protection to you and your family and also staff, so we can put you in the best place to get treated. And as I said, most children with coronavirus get a really mild form of the illness, and that's really, really reassuring for children.
Yes, definitely. Are doctors at GOSH helping to find a cure?
Yeah, so it's amazing some of the things that have been happening around the hospital. Normally it takes months and months to set up research trials in order to look at new treatments and investigations, and we've got 16 set up within about 6 weeks. And it's really amazing. So we've got many people from the Institute of Child Health, from the hospital, from other hospitals, all working together in our labs here, in the Zaid Centre, in the Institute of Child Health, to really look at understanding coronavirus more. We're looking at national studies into children to know how the disease affects them. And hopefully, we are hopefully being the lead in that for children in order to discover the most we can in order to give the best treatments that we can. So I think we're trying to do our bit and are really partnering with everyone really well to try and do that. I'm really proud of the team here, and I think they're making great strides.
That's brilliant. Josh, who's 17, also has 2 questions. Josh would like to know if a child's appointment or stay at GOSH has been cancelled, what would happen?
So I think it's really important to know that we want to look after all the children that come to Great Ormond Street, or even the children that need to come to us that haven't come to us yet. What we're having to do is to prioritise and to try and work out which children and their families should absolutely come into hospital and be seen, which children can be seen via other measures. So we're doing lots of consultations and clinic appointments in a similar way to this with video calling, and sometimes using the telephone if people haven't got a computer. Or sometimes, if we can delay appointments, and that's the right thing to do, then we'll delay it to a point in the future whereby we think it's safe to do so. I don't want people to feel really nervous or anxious about that, and if you are worried, then please do contact the hospital, because actually it's really important you do touch base with us. And you can also link into us via the GOSH portal in order to contact your care team and your medical teams in order that we can actually help you. And if there does need to be an appointment, we can give you that.
What happens if a young person is transitioning to another hospital at the moment?
So I think there'll be different circumstances for different people. So some people will absolutely need to go on to another hospital in that transitioning phase to get a specific treatment for their condition. And where that happens, absolutely, we're trying to transition and send children where they need to, or young adults, where they need to go in order to be treated. It may be for some patients that transition is slightly delayed. And the reason for that is that actually we know you here at Great Ormond Street, and actually it's probably a safer place while all these things are going on in the world that we keep you here so we can look after you. So there'll be different solutions for different people. But again, if you're not certain, then the My Gosh online account, which many of you have now, you can contact us and we can clarify that. But hopefully we're going to treat you in the right place, but we will treat you in the right place, which is the safest for you. And if we have to delay transition, then that's what we'll do in the short term.
Great. Liam, who's 15, would like to ask, do you think that the government are doing enough to protect frontline NHS staff?
So I think here at Great Ormond Street, we have never run out of what we call PPE, or personal protective equipment. So, which I think is a really great thing. It's so important that we support our teams here and every hospital. I think it's a huge challenge. Every country in the world is suffering with the same problem that we have in the UK. And I think that's put a tremendous strain on how we get some of the protective equipment. But I am really pleased to say we've always so far been managed to provide that at Great Ormond Street. And it's absolutely our determination that we'll continue to protect our staff in every possible way that we can. But also importantly, we protect you, the people coming here, and also your moms and dads that come with you as well. And that's our ambition. And so far we've managed to do that here in what is a big problem.
Brilliant. Our last two questions are from Rose, who's 16. Rose would like to know, how is GOSH being affected differently to other hospitals?
So I think, as we've said, it's really fortunate that children in general are not as affected as adults by this condition. So we've got some areas of the hospital which are a lot busier than normal, and some areas of the hospital which are much less busier than normal. So what we've done is we've sent some equipment to other hospitals. We've got 78 of our staff, of our nurses and doctors, who've gone also to other hospitals to try and help those other hospitals out, as well as try and manage all the patients that want to come and see us and manage their health too. So we are playing probably a different part in relation to other hospitals by sharing and being supportive and trying to help other hospitals through what they're going through, whilst also trying to actually do everything we can for children and make sure their health remains good as well. So our role's been slightly different, but our staff have been absolutely brilliant. And our nurses and doctors and scientists have been brilliant at doing roles which they wouldn't normally do, and working in other organisations which they wouldn't normally do. And I'm really proud of them for that. And that's the kind of the role we've played. That's
great. Finally, how will you thank your staff for their work throughout this outbreak?
Well, food always works well. So we've got a shop in the hospital which the staff can get free food, and we've had a gazillion Easter eggs, which actually we couldn't eat them all, so therefore we've handed them on to other hospitals so they can get a chocolate benefit. Also, I think just thanking different staff members a lot. I think every week we have a kind of a team meeting, and we normally have one thank you a week. I think we're now up to 6 a week, and still that doesn't mean we're thanking enough people. So I think people have been absolutely tremendous, and thanking people directly, writing and emailing people, just expressing that gratitude, and then filling their tummies up, I think is a great start of how we appreciate what they've done, because they really have done outstanding work. I think it's hard to know how long this is going to go on for, and I think we also need to understand that we need to sustain people and get people to recognise that we might be working differently for quite a while. So I think just about pacing people as well, and giving them that energy and thanks and all the things they do, hopefully will sustain them and they'll get the message. We really think they're doing a great job.
Brilliant. Thank you so much for this, Matt. They were really, really interesting answers as well. Yeah, and it's really great to know how Gosh are supporting like their patients, their families, but also other hospitals in the UK and around London too.
And it's great to answer the questions, and I'll be happy to answer any of the questions which the YPF or anyone else has, because I think it's good to talk about these things.
Yes, definitely.
Thanks very much.
Thank you.